Hi, my name is Tiffany and I'm a family nurse practitioner student with the University of Texas Rio Grande Valley. Today I will be presenting to you about COVID-19 safety, specifically for students and teachers going back to in-person group learning. I hope this presentation will help ease the minds of parents going back to school, as well as assist the teachers and students in going back safely. I will be shortly presenting my PowerPoint. Thank you.
Okay, so now I'm gonna start presenting my PowerPoint. This is a main topic as I introduced earlier. This is regarding the students who are going to be going back to in-person group learning, also the teaching staff and all the staff in the school in general, okay? So, staying safe during COVID-19, how to keep our students and teaching staff safe during the COVID-19 pandemic. So I just want to introduce myself a little bit more. I am a family nurse practitioner student, as I stated in my previous video, but I have been a nurse for a few years and I've been working in the emergency room. So I did see during the COVID crisis, especially around July and August, more like around June, July. I know it started getting worse like around April. We did see a lot of cases, especially living in the Rio Grande Valley. Our hospitals were at a max. So I did see a lot of these cases, and I learned some things from them that I feel would be good to share. But now I know it's also a concern, especially for those going back to school. I know a lot of parents are scared. I also have like a family member that would be going back to in-person school learning, but then of course they delayed it and now they're doing those Zoom virtual school just for safe practices, which I understand, but I think as more businesses are opening up, we're starting to consider like putting the students back to in-person learning. I believe it's possible as long as we stay safe and we follow the CDC recommendations. The CDC, I will explain later. We are using a lot of those recommendations here in America as healthcare providers. We do look to them for our information as well. I will briefly discuss what is COVID-19. I'm going to then go to the CDC recommendations. I'm going to talk about some of the challenges, especially for some of these kids that are relying a lot on the school system, not just for the education, but for proper meals. And then I will give some tips on how to keep our students and teaching staff safe. So now, what is COVID-19? So, COVID-19 is coronavirus disease. It is an infectious disease caused by a newly discovered coronavirus. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So we all know that it just started in Wuhan in China. Then, of course, in this modern world, with how we're able to travel with the planes, then of course it's eventually spread to our area here in the United States. So I will be talking about how to protect ourselves. I'll be recapping some of the recommendations from the government. This is actually, like it says, the newest one. There's actually about five of them that I believe is out there. But this is the most current coronavirus disease that is very infectious, as we know by how easily it transmits. all those there's droplets that comes out of our bodies even as we're speaking right now. This is we lose air. That's why the as you see here in my little picture, we have like our mask. It really protects you because it keeps your droplets to yourself and helps prevent it coming out. So then let's go to the signs and symptoms of COVID-19. So I put in here the CDC had a lot of good pictures that basically these are the main symptoms. Fever, cough, shortness of breath. That's why that if you might be going around to stores that people are taking your temperatures because that's just one of like the cardinal signs. But there's many symptoms of COVID-19. This is the fever or chills, the cough, the shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. And as you're looking at some of these symptoms, you're thinking a lot of these are very common. So that's why they really like to look for these fever, cough, shortness of breath. That's why it's very important to, besides the mask, is to just stay away from sick people. If you know that they're having those symptoms or they're potentially exposed, those are things you need to look out because in case you are having these symptoms when you go to the hospital, that's one of the first things we ask there in the emergency room. Have you been around anyone with COVID-19? Is there a possible exposure? And they will ask you about your symptoms as well. So, of these, new loss of taste or smell, that was a very common one I saw, especially among young people. Here, fever or chills, of course, the cough, shortness of breath or difficulty breathing. This is what really is the dangerous part of it. Hopefully, if you do catch it, that this part is what you really don't want to have. That's usually why people get admitted. So they can't breathe, their labs get abnormal because of the difficulty breathing. It is a viral pneumonia. So a lot of the people who have been getting the COVID-19, they tend to have damages to their lungs. The tissue gets scarred. And the thing with scarred tissue is that it never works as the original tissue. So it's not going to function as properly. So then that leads to further disabilities. So here, this is kind of an older picture as you can see. Symptoms may appear 2 to 14 days after exposure. If you have been in China within the past 2 weeks and developed symptoms, call your doctor. This was at the beginning of the COVID-19, so that's why most of the people that were getting it had just traveled to China or maybe exposed to someone who's been in China. Now, since it is pretty much everywhere, you don't have to have traveled. It could have been your neighbor. It could have just been going to Walmart. So again, these are very important to just be proactive and just remember that you could be saving someone else's life. You're saving your life. You're saving your family member's life just by a simple thing, putting on a mask. Okay, now we're going to move on to the next slide. So as you see here, symptoms may appear 2 to 14 days after exposure to the virus. That is why that they like you to quarantine for 2 weeks because it can go away on its own. It's a virus. We're the treatments that we have in the hospital and what the doctors tend to give It's supportive care. We're just trying to help the virus get out of your body sooner. So symptoms may appear 2 to 14 days after exposure to the virus. They want you to quarantine because that way you're not spreading it to others. And while as an individual they may not have as were bad symptoms as another individual, I believe that that's not something you'd want to chance. So staying again as I go on with this presentation with my experience as well working in the hospital, I do want to emphasize these facts. So one of the biggest things to call 911 here in United States, that was our emergency line. Call 911 if experiencing these symptoms: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, unresponsiveness. So trouble breathing, like I said, that's one of the big symptoms because it's a pneumonia. Pneumonia gets all congested. It's attacking your lung tissue. Your trouble breathing is because your lungs are not functioning as they could, and you might need some oxygen. Persistent pain or pressure in the chest. This could be the pneumonia. This pneumonia can cause pain in the chest area, but this is dangerous just because it's near the heart. You want to make sure that you want to get that checked out, because if it is your heart, that's very dangerous. You don't want to be having a heart attack. So if you are having this, that's a very important thing to call 911 for. New confusion. So, as I've worked with the COVID-19 patients along with the other providers, we did note that they tend to have a lot of blood clotting issues. So, as you can see, like all of these things, they're all interconnected. Heart, lungs, brain. The thing is, if you have blood clots, maybe it traveled up and maybe you're having a stroke. Blood clots around your chest, that will impair your breathing. The pain or the pressure in the chest, besides just a heart attack, they could be the blood clot in your lung. And again, these are emergent situations because without getting these taken care of fast, there's a chance that it could lead to patient demise. Inability to wake or stay awake, that could be like, oh, you're not getting enough oxygen. So there's some metabolic respiratory issues starting to build up in your body. Bluish lips or face, lack of oxygen, unresponsiveness. Something we like to do in the hospital is we do this thing called a sternal rub. So the sternum is that area between your nipples. If you even just press with mild pressure, that bone in the air, it hurts. So if you press that and rub against that area and the person is still not waking up, that's an emergency. You need to call 911 because there is something going on there. So they start by recommending protect yourself and others from infection by washing your hands using an alcohol-based rub frequently and not touching your face. Practice social distancing of 6 feet between, wearing a face covering your nose and mouth. Keep rooms well ventilated, avoid crowds, and cough into a bent elbow or tissue. But again, you should be wearing a mask. Check local advice where you live and work. So, main thing when you're using alcohol-based hand sanitizer, make sure it's at least 60% and above. When you put it on your hands, you're gonna rub it all around the areas until it's dry. This lady here, she's covering her face. 6 feet away is just really, if you see this little picture here, you're just trying to really keep away from the particles as much as possible. So especially around strangers, not your family members, then try to stay away from them. Frequently wash your hands. That's like the number one thing that can help prevent the spread of infection. Hand hygiene is a crucial thing. And I will actually be demonstrating a video later on to show you how to properly wash your hands. And here I mentioned that besides the washing the hands, I'm going to be mentioning how to also place the protective equipment. And I'm really targeting this in the school setting. I'm thinking of the school nurse. The school nurse will probably be having to expose herself to potentially sick children. So I will also be demonstrating a video that shows how to properly put on and take off all these items.
So I will be showing you how to wash your hands properly, as good hygiene will help prevent the spread of COVID-19, but in general, it is good hygiene. So first of all, we're gonna start by turning on the water. We're gonna wet our hands thoroughly. We're gonna get a good pump of soap. Then the recommendation is to sing the birthday song 2 times because you're aiming for 15 to 20 seconds, okay? But as you can see here, I'm starting by doing my palms. Then I'm rubbing around the outside. And here, actually, they also recommend you scrub your fingernails like this. You do the middle. This is always how they teach us in nursing school. You do your thumbs and also your wrists, as these tend to be forgotten areas. So once you reach your 20 seconds, wash your hands. Like so. And the actual recommendation for this part would be not to touch this with your hands. You'll be getting a dry paper towel. But here you go. Then my 20 seconds. Gonna dry my hands with a clean towel. And again, in a proper setting, this would be getting a paper towel and turning it off. Okay, now I'm gonna be showing you how to put on and take off personal protective equipment per CDC guidelines. I'm gonna start first with the gown. And I'm specifically doing this like for the school nurses who's going to be possibly exposed to sick children or sick students in general. I'm gonna put this on. Make sure you tie it back. Use it as to prevent any spills. In this case, we're just trying to be as safe as we can, especially for the providers who's going to be in direct contact with them. Okay, doing it at the back. Next, gonna put on the mask. Next, face shield or goggles. Here I have the face shield. Then I'm putting on some clean gloves. And you're ready. So now I'm going to show you how to take it off. And it's basically backwards. The main important thing when you are taking it off is you're trying not to touch any of the contaminated surfaces. So first, we start with gloves. Remember, that was the last thing we put on. And if you take a look, I'm actually putting my finger inside to try not to touch it. You have a trash can right here, drop. Next, I'm gonna take off my face shield or goggles. Next, my mask, I'm taking it off by the strings. I'm trying not to touch this front area. As we are using masks regularly, the contaminated area would be this part. So try not to touch that. You have a trash can, just drop it. Next, just taking off my gown. Again, just trying not to touch the infected areas. Putting it together, rolling it, and touch. And that's how you put on and take off personal protective equipment. Thank you.
So, how to clean or disinfect for COVID-19? Wear disposable gloves to clean and disinfect. You don't want to contaminate your hands, and also you're going to protect your skin, as the skin is actually your first barrier against infection. So if you break your skin, the potential for getting infections is going to be higher. Clean surfaces using soap and water, then use a disinfectant. Cleaning with soap and water reduces number of germs, dirt, and impurities on the surface. Disinfecting kills germs on surfaces. Practice routine cleaning of frequently touched surface, and some of these high touch surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, lots of things. Basically, if you're touching it, other people are touching it, then disinfect it. So here's a little guide on this is the EPA. They're like the environmental part of the government, and basically you should make sure that it's approved by them to actually use the product to clean and prevent COVID from spreading. Now we're gonna touch base on who needs to wear a mask. CDC recommends that you wear a mask in public settings around people who don't live in your household and when you can't stay 6 feet away from others. Masks help stop the spread of COVID-19 to others. So, do choose masks that have 2 or more layers of washable, breathable fabric. If you don't have the surgical mask, you can use a cloth. I believe that earlier on the Surgeon General, which is like one of the leaders regarding the healthcare, they actually would even show that any cloth would be good, but it is what you really want is a snug fit around your face, just so like the particles. What we're thinking is the particles, your particles, and others' particles. You don't want those to intertwine with each other. So as you see, completely cover your nose and mouth. I do see a lot of people who have it lower than their nose and just covering the mouth. I've heard some people say it's because they say they can breathe better. But the thing is, you're not protecting yourself or others when your nose is showing, because those are all interconnected. That's your nose area will directly go to your respiratory area, your lungs. Those are all interconnected. So if you're actually exposing your nose, you're not getting the proper protection that it's intending to do. Fit snugly against the side of your face and don't have gaps. So do not choose masks that are made of fabric that makes it hard to breathe, like vinyl. Have exhalation valves or vents which allow virus particles to escape, or are intended for healthcare workers, including N95 respirators or surgical masks. I know now, like if you go to the store, there's tons of surgical masks being sold. The thing with the N95, and they do say that there, I know there was that shortage early on, and it was very hard for us because we have to be fighting these virus, being frontline workers, and we were running out of the protective equipment. A lot of healthcare workers were dying, and the thing that could protect them is this. Also, another thing that I want to say is that you're supposed to be fit tested for these N95s. Actually, working in a healthcare environment, they actually make you take a test, like with a sugar spray. That's usually the employee health nurse that takes care of that. And they're gonna be spraying this area. You're gonna have like a plastic, clear plastic over. And if you can taste that sugar, then your mask is not properly sealed. These are only really working if it's a snug fit around your face, and if you're able to taste or anything like that, then it's not actually doing what it's supposed to do. So that's also another thing that not everyone might not know, I believe. So you can't actually just put it on. You're supposed to be fit tested for these. Okay, so now who needs to wear a mask? Wear masks with two or more layers to stop the spread of COVID-19. So wear the mask over your nose and mouth and secure it under your chin. Masks should be worn by people 2 years and older. You're basically trying to prevent suffocation. Masks should not be worn by children younger than 2, people who have trouble breathing, or people who cannot remove the mask without assistance. Do not wear masks intended for healthcare workers, for example, N95 respirators, and mainly because you need to be tested for those to fit how snug they are around your face. Because I've seen people can just buy them, but and actually when we go to the hospital, we actually get tested to make sure it's our right size, that it fits properly, because the point is to prevent any particles at all, um, that are so small, not just droplets, particles. That's why the N95 is mainly used, because you're trying to really filter it. But the thing is, if there's any leaks, it's not doing its job. So this is just a bit humorous, how not to wear a mask, but the thing is, people actually do these things. That's why, like, people need to know that this is not correct. The proper way is covering your nose and mouth and a snug fit. So how to take off your mask is also here, because basically the point is, the area like in the front part of the face, you're gonna consider that contaminated. You shouldn't be touching that area. If you see that they're folding the outsides, you're just that's basically just trying to not let that area touch anything. If you're doing the cloth ones, as you can rewash them, but make sure whenever you're handling these things that you always clean your hands after. Just some more facts from the CDC. If you are, find a mask that is made for children. If you can't find a mask made for children, and again that's for 2 years and older, check to make sure the mask fits snugly over the nose and mouth under the chin. They were just saying that there's evaluation is still ongoing because I see people use these gaiters, and just face shields alone is apparently not, they're not sure about how effective that is, just that alone. For sure the mask, and we do use the face shields too, but in conjunction with the mask, not by itself. Special situations glasses. If you wear glasses, find a mask that fits closely over your nose, or one that has a nose wire to limit fogging. And the nose wire does help. Like I do use glasses, and that is an issue. If it's doing that, it could be leaking, basically. If it's fogging around your glasses. So, and plus it's gonna make it harder for you to work and see. So try to get like the one with the wire, because if it's actually snug around that area, it shouldn't be fogging. So just a brief overview on some of how to check if infected. You could go to like a clinic, and even I even see places like Walgreens, CVS that offers the testing. So the nasopharyngeal swab, it's a swab that goes to your nose and touches your throat, will tell you if you are currently infected. I want to emphasize that because there's also the antibody test. Blood test that tells you if you were previously infected, does not tell you if you are currently infected. So we do a lot of the nasopharyngeal. As a nurse, I would be collecting them as well. It's actually more accurate than just swabbing like the little tip inside your nose, because it touches your throat. So that actually really gets you a good sample. And there are places that do the send outs. So maybe they'll give you the results after a few days. In the hospital, we do have the rapids that maybe tells you in an hour or two. And I did hear about outpatient places that also that also offers that. But as far as I know, in our area, the hospital, because I work in the hospital, they do the rapids. The antibody test, like I want to say, is that tells you if you were previously infected and if you possibly still have it. But the thing is, it takes time for these antibodies. The antibodies are um, your immune system is making them to fight against the virus. So if you're just getting the antibodies to test you if you were previously, or excuse me, to check if you're infected, it's actually not as accurate as the nasopharyngeal swab, because that will tell you if you're currently infected. Whereas the other one, it takes time for them to actually show in your body. So if you test positive, stay home. You have to do the 2-week quarantine. Rest, hydrate. You have to go to your family doctor, and they might be prescribing you some neb treatments, might be giving you some steroids. Really depends on your symptoms and your presentation. And they could be prescribing you some vitamins, vitamin C, zinc. Those are typically in that package. So basically, stay home, rest, let yourself get better. Try to eat a nutrient heavy diet and get yourself better. So now that I've touched base on COVID, what it is, testing. I've spoken about what the CDC is. Now I'm going to speak about challenges regarding attending school. So schools provide more than just academics for children and adolescents. In addition to reading, writing, and math, Students get exercise and have access to mental health support and other services that cannot be provided with online learning. For many children and adolescents, schools are safe places to be while parents or guardians are working. For many families, schools are where kids get healthy meals, access to the internet, and other vital services. So, just some info. The pandemic has been especially hard for Black, Latin, Native American, Alaska, Native children and adolescents, and those living in low income families. One in five teens cannot complete schoolwork at home because they do not have computer or internet connection. So, it would be nice if the children are back in school. I know that there's families that are struggling. It's a big change for a lot of people who are have to homeschool their children, or the parents who may not be as tech savvy that has to learn how to use this technology for their kids, because you don't want them to be behind in their learning. And that's just for students of all ages, not just the children specifically. But there are also those that unfortunately are the ones who are relying on getting their regular meals at school and their interactions, that it is sad that that's getting limited because of the virus. So recommendations for school practices: physical distancing. The goal for students and adults is to stay 6 feet apart to help prevent the spread of the virus. However, research has found that spacing desks at least 3 feet apart and avoiding close contact may have similar benefits, especially if students wear cloth face covering, or like the surgical masks, because they have been selling those in pretty much every major store that I've gone to. They've, like Walmart, HEB, they've been selling those and do not have symptoms of illness. Teachers and staff should stay 6 feet apart from other adults and from students when possible. Teachers and staff should also wear face coverings, limit in-person meetings with other adults, and avoid areas such as staff lounges. When possible, schools should use outdoor spaces and unused spaces for instructions and meals to help with distancing. For example, activities like singing, band, and exercising are safest outdoors and spread out. You're basically just trying to prevent crowding. Cloth face covers and hand hygiene. All children over 2 years and all adults should wear face coverings that cover the nose and mouth to stop spread the virus. When worn correctly, these coverings are safe to wear for long periods of time, such as during the school day. In addition, frequent hand washing with soap and water is important for everyone, or sanitizer with at least 60% and above alcohol. So, classroom changes. To help limit student interaction outside the classrooms, schools should consider having teachers move between classrooms rather than having students fill the hallway during passing periods. Allowing students to eat lunches at their desks or in small groups outdoors instead of crowded lunchrooms. Leaving classroom doors open to help reduce high-touch surfaces such as doorknobs. Testing and temperature checks. The CDC does not recommend COVID testings of students and staff. Testing only shows whether a person is infected at that specific moment in time and may not be useful in preventing outbreaks in school communities. And I do have to say that, like, because some patients think that when they come and they have symptoms, that, oh, last week I tested and I was negative. The thing is, from last week and now, you could have gotten infected again. You can always get infected even if you may have tested negative. once, twice, or more. I know people who have gotten the test multiple times. As long as you were possibly exposed, you can still get infected. So, taking students' temperatures at school may also not be feasible, but you can monitor your children's health at home and keep them home if they are not feeling well. Schools should frequently remind students, teachers, and staff to stay home if they have a fever of 100.4 degrees Fahrenheit or greater or have any signs of illness. So, symptoms at school. School nurses will be taking the temperature of anyone who feels ill during the school day, and there should be a specific area to separate or isolate students who are not feeling well. To stay safe, school nurses should use PPE such as N95 masks, surgical masks, gloves, disposable gowns, and face shields. Cleaning and disinfecting. Schools should follow CDC guidelines on proper disinfecting and sanitizing classrooms and common areas. Recommendations for school practices. Students at high risk. While COVID-19 school policies can reduce risk, they will not prevent it. Some students with high risk medical conditions may need other accommodations. That's why you should talk with your pediatrician and school staff, especially the school nurse, to see if your child needs additional solutions to help ensure safety at school. The students with disabilities, the impact of schools being closed may have a greater effect for students with disabilities. They may have a difficult time transitioning back to school after missing out on instruction time, as well as school-based services such as occupational, physical, and speech language therapy and mental health support counseling. Schools should review the needs of each child with an individual education program before they return to school and provide services even if they are done virtually. Immunizations. It is important that students return to school that they are up to date on their immunizations. It will especially be critical that students and staff get their flu shot this year to reduce the spread of influenza this fall and winter. Because besides COVID, it is flu season. So that's around October to March. You don't want those extra risks. It would be very wise to be up to date on your immunizations and get your immune system ready for any other illnesses that are very prevalent during the winter season, especially. So, vision and hearing screenings should continue in schools when possible. These services help identify children in need of treatment as soon as possible and prevent interferences with learning. Behavioral health and emotional support. Your child's school should anticipate and be prepared to address a wide range of mental health needs of students and staff. This includes providing mental health support for any students struggling with stress from the pandemic and recognizing students who show signs of anxiety or distress. Schools also can help students with suicidal thoughts or behavior that needs support. So this pandemic has stressed a lot of people. They may have lost some loved ones. They may have gotten sick themselves. There's a lot of people that got isolated, even if you're not sick, because they're trying to prevent sickness. So it can take a toll on the mental health. So make sure that that is not neglected, because your mental health can eventually take a toll on your physical health. Nutrition. Many students receive healthy meals through school meal programs. More students might be eligible for free or reduced meals than before the pandemic. Schools should provide meal programs even if the school closes or the student is sick and stays home from school. So I just wanted to show some classroom examples. I have a friend that is a teacher and she was kind enough to send me these. So as you see here, have access to hand sanitizer. Of course, wash hands regularly, but it's good to have this access, especially if you see here that there's a sharpener, a pencil sharpener. So that handle's gonna be touched regularly. Look here, a light switch. That's gonna be touched regularly as well. So it's good to have a hand sanitizer close by. It's also very convenient. You don't need to wash your hands. Just put it on. Make sure you're covered thoroughly. And there you go. Space out the dust. I thought this was a really good example. As you heard, I spoke about earlier that at least 3 feet is recommended. And if you at least wear the face covering, that should be good for the whole day. Keep the 6 foot distance. You'll see these in stores. Here, I think it's good that they have it in the school as well. Make sure that the students have reminders to use masks. So, to conclude my presentation, while we as a country and a global community are struggling with the COVID-19, we can better protect ourselves with the information that is available to us. CDC is USA's resource for information and protection info from numerous diseases including COVID-19 virus. By using proper masking, hand hygiene, and social distancing and disinfecting, it will assist the students, families, and teaching staff to start going back to in-person learning in a safe manner. We need to protect our vulnerable populations, including students who will be affected by the changes in the pandemic due to the commonly common group learning practices. Together, we can help our communities regain a sense of normalcy while prioritizing safety. And I want to thank whoever is listening to this presentation. Thank you for listening. I hope that this can help. If you're a student, you're a teacher, you're you're a family member, a parent. I hope you learned something from this and that you can take it into practice. I do give my verbal consent for anyone who wants to use this video for educational purposes. And just stay safe out there. Thank you very much. Here's some resources at